I want to thank everybody for joining us today. My name is Dan O'Brien, and I am from Children First, and I'm one of the co-chairs of the Family Care Coalition. We are here today as a coalition, along with our House and Senate partners, to call for the passage of a statewide paid family and medical leave program. We are here to advocate for two pieces of legislation, both referred to as the Family Care Act, House Bill 181, which is ready for a full House vote at any time, and Senate Bill 580, which was newly reintroduced by our Senate champions in the past few weeks. 13 states plus Washington, D.C. have workers that are guaranteed access to paid family and medical leave whenever they have a new baby, they are taking care of a serious health condition either for themselves or a loved one, such as cancer, they are a victim of domestic violence, or they're a military family trying to adjust to a military deployment in their family. We are surrounded, 4 of our 6 neighboring states, New York, New Jersey, Maryland, Delaware, and states across the country are increasingly giving access for a program that is paid by workers to be able to take paid family leave when they need it most. In Pennsylvania, we are currently making families choose between financial stability and their own family's health. That is not acceptable. So here today, we have our Senate champions, our House champions, and coalition members from around Pennsylvania that are calling for the passage of what Pennsylvania's workers have earned and deserve, and that is access to paid family and medical leave. It is both pro-business and pro-family, and we believe that this should pass now. We cannot wait any longer. So I want to go ahead and first introduce one of our Senate champions who has reintroduced Senate Bill 580, Senator Devlin Robinson.
Good morning, and thank you all for gathering in support of the paid family leave program in Pennsylvania. I'm Senator Devlin Robinson, and I'm the prime sponsor, along with my friend Senator Collett, of Senate Bill 580, the Pennsylvania Family and Medical Leave Act. I'm pleased to join this bipartisan group advocating for a program to help families navigate some of the most joyous times in their lives, like the birth or adoption of a child, and the most turbulent, like dealing with an accident, illness, or domestic violence situation. Paid family leave is good for workers, good for business, and good for Pennsylvania. According to a recent study conducted by the Prenatal to 3 Policy Impact Center at Vanderbilt University, the impact of paid bonding leave when a child is born would generate $379 million in annual net benefits to the Commonwealth of Pennsylvania families, businesses, and the region as a whole. Specific benefits include fewer infant hospitalizations, improved postpartum health for mothers, less alcohol consumption for fathers, and greater food security for families. Further paid leave would actually result in more weeks worked by mothers. A projected 431,000 more weeks worked, amounting to over 5,000 additional full-time workers each year, and almost 7,000 more mothers working at the pre-birth employer at their child's first birthday. This is consistent with the experiences of businesses in other states with paid leave programs who experience less employee turnover because of the program. I greatly appreciate the support of coalition members, including Children First, J. Badger Consulting, and the Alliance for Safety and Justice, and providing valuable feedback on the bill. That feedback resulted in adding victims of violence, including victims of domestic abuse, and individuals with disabilities who are victims of abuse, neglect, or exploitation as qualifying for paid leave coverage under the proposal. I also want to recognize my colleague, Senator Collett, and her staff for working with me on this bipartisan bill. This bill is critically important to my constituents and to workers all across Pennsylvania. I look forward to working with all of you as we consider the next steps for the bill in the Senate. Thank you.
Thank you, Senator Robinson, for helping to lead our bipartisan effort in the Senate. And I want to introduce our champion for the bipartisan effort in the House, Representative Dan Miller.
Okay, good morning. Good morning. I'm very excited to be here because we're here talking about something that matters to families and the businesses in Pennsylvania. Look, the reality of it is paid leave is a game changer and we are behind the times. We need Pennsylvania to move now to make sure that we are helping not just a little bit of families, not just a small amount of families, but a large amount of families. Millions of people can be benefited by this bill. Now is the time. Now is the time. Now look, we should be learning lessons from what happened just a couple of years ago when people did not have paid leave. And the reality of it is while that was bigger then, those things are still happening today. Family by family is struggling right now in Pennsylvania, hoping somebody doesn't get sick, hoping that maybe they'll spend together a little bit of time when they go to have a child, that they might be able to stay home for that baby, hoping that maybe a father might be able to spend some time, maybe when they adopt a child, they might be able to spend some time, maybe when mom or dad gets a little bit sick, they're going to be there for that time. This is what is happening across the state. Family and family, home to home, when we don't have paid leave. The majority of workers in Pennsylvania do not have paid leave. What decade are we in? What state are we in? What are we supposed to be about? Well, we're about paid leave, right? We don't need it tomorrow, we need it now. We need the vote to come on during the season of budget when we are investing and showing our priorities that we get it done. We need it, not only the House bill, not only the Senate bill, we need people to come together to find that compromise that gets a bill to the governor so that the governor will sign it, which I know he will, to make sure that workers and families and businesses not only can be there for those times that we all want to be there for, but the businesses can be competitive no matter where you are. We need to help those small businesses, those moderate businesses, who want to be in the game, but need a little assistance doing it. And we've been watching state after state all around us already make that difference, already help those families, already make sure that no matter who you are, you have a chance to be there for those moments that matter. And look, everyone up here has had those moments. Some of us has had to struggle to be there. We are tired of that struggle. We do not want to miss anything else. We don't want you to miss anything else. We need everybody there to be there for those moments that matter at home. And the way to do it is you need paid leave. Look, having access to leave is nice. That's great. If you can't afford to do it, it's meaningless. It's useless for the majority of workers here. So we're not interested in that. The FMLA started the path that we intend to end with paid leave here in Pennsylvania. And look, I want to take a quick moment just to thank some of our colleagues who I know are here as well, including Senator Collett. We heard from my friend Senator Robinson, Representative Cobb, Representative Meghan, Representative Serrato. Where's our people? Is he still in the perfect course? Of course, Kevin's trying to go through everybody who's here. And of course, Senator Collett, who's been helping to lead the charge. All right, we're not going to put Nancy. That's nobody does. So Nancy, of course, is here because she knows what it matters. So look, here's what we need. We need your help because we are in the budget time to pass this bill. I don't care which one gets across. We're going to find that compromise. We're going to work together and get it done. We need it done now. Paid leave has to happen in Pennsylvania. Now's the time. Thank you very much.
I won't forget Representative Gina Curry, who's a champion for kids and many issues, so thank you. I want to introduce one of our other champions in the Senate, Senator Maria Collett.
Good morning, everyone. I took my glasses off. I just want to say that I am so thrilled to be here with all of you. I'm Senator Maria Collett. I am proud to represent Pennsylvania's 12th Senatorial District in Montgomery County, and I am so pleased to join our broad coalition of hardworking Pennsylvanians, stakeholders, Representative Dan Miller, and all of the senators and representatives that are here today, sponsors of HB 181, my co-prime sponsor in the Senate, my friend Senator Devlin Robinson, all united today in our determination to deliver access to paid family and medical leave to the millions of Pennsylvanians who don't have it. As a nurse, a parent, and my father's caregiver up until his passing, the issue of paid family and medical leave is a personal one to me. And as a legislator, I'm fighting for working families to have the freedom to care for themselves or their loved ones without having to sacrifice their ability to afford basic necessities. Without access to paid leave, far too many Pennsylvanians are forced to make the impossible choice between putting food on the table and keeping a roof over their heads, or caring for their health and the health of their family. Motivated by my own experiences and by the stories of constituents like the Swain and Sheeter family who lost their infant daughter, Emerson, to a congenital heart defect, I first introduced the Family Care Act in 2019. This March, Senator Devlin Robinson and I reintroduced the bill as SB 580. This is our year, folks. Without putting financial strain on small businesses, this legislation will give hardworking families the ability to invest small deductions from their weekly earnings into a state-run employee insurance program, empowering them to take the time off that they need without risking their economic security. And with only 13 states offering paid family leave, this program will give Pennsylvania's economy the edge it needs to attract, retain, and grow our workforce. We know that the Family Care Act will benefit our families, our small businesses, and our economy as a whole. And most importantly, it is what families deserve. Our partners in the House of Representatives, led by Speaker Joanna McClinton, recognized how much of a game changer this will be for Pennsylvanians in every corner of the Commonwealth. And I was beyond thrilled to see the Family Care Act pass their chamber last June. It's time for working families to feel empowered to put their health and their well-being and the well-being of themselves and their loved ones first. It's time for businesses to have the tools they need to compete for talent. And most of all, it's time for the Senate to act. Let's do right by Pennsylvania families and get the Family Care Act across the finish line to Governor Shapiro, who, as some of you may have heard, is ready to get stuff done. Thank you.
Thank you, Senator. Next, I want to introduce one of the other co-chairs of our statewide coalition, Josie Badger.
Great to be here. Yes. So, back in 10th grade, many of us read the words. It was the best of times, it was the worst of times. But with the Family Care Act, it would be there for all of those times. We needed to have a bill that is there for families who are celebrating a new child, but also for those families who are dealing with disability, dealing with medical crises and mental health crises. Over 1/4 of Pennsylvania households have an individual with a disability in that home. But it's not surprising that 1/4 of households with a person with a disability in them are working poor families that rely on benefits to survive. And half of that are also under the federal poverty limit. It is time to raise individuals with disabilities and their families out of the confines of poverty. Time to get people with disabilities disabilities the chance to be able to work, even though we know that we may be facing medical emergencies and need medical care. It is time to allow families of children with disabilities to be able to take the time off to care for that child, to see the physicians, the therapists, without worrying about losing their job or the financial stability that they need to be able to keep their family together and their child in their home. It is time for us to support the largest minority group in Pennsylvania and the world, people with disabilities. Join us in passing the Family Care Act.
Thank you, Josie. Thank you. Close to 4 million workers in Pennsylvania do not have access to paid family and medical leave. And today we have Maurice Cobb from the United Steelworkers to talk about the impact that it will have on workers across the state. Maurice?
Good morning. My name is Maurice Cobb. I'm with the United Steelworkers. I handle the legislative agenda for District 10, which encompasses most of Pennsylvania. I stand before you today because at some point all of us will need to take time off for a sick family member or bond with a new addition to the family. However, most American workers do not have paid time off. In fact, the United States is one of the only countries without a national paid leave policy. It's past time we change that. Steelworkers are fighting for paid leave at the bargaining table for our members, so our members can have time off with their families. But we're also fighting in state houses all across the country because all workers deserve this fundamental right. Only 23% of U.S. workers have access to paid family leave through an employer, and a mere 40% have access to short-term disability insurance. That leaves nearly half of all working parents without any way to take care of a sick child when they have to take time off. Listen, if paid leave were an option when my wife was pregnant with our daughter, she wouldn't have had to continue working as a police officer during her high-risk pregnancy. Instead, she had to work until her duty belt couldn't fit her waistline anymore. She was then put on desk duty for a period of time until she was put off of work with no pay at all. That was pretty hard on our financial status. I mean, we got by, but it wasn't easy. Workers deserve better than this. We all deserve better than this. We deserve the opportunity to care for our loved ones with health needs and not to stress about how to pay the bills. We also need and deserve to take care of ourselves so we can return to our jobs healthy and continue contributing to our workplaces and the larger economy. Laws like the Family Care Act can make this a reality for all of us. It's in all of our best interest that we pass this legislation swiftly and elect leaders like those behind me who fight for our freedom to care for our health and the people we love. Thank you.
Next, we have a representative from the American Academy of Pediatrics, Dr. Amaka Nnamani.
It was 2 days before Thanksgiving, over 12 years ago, November 22nd to be exact. I'd achieved my highest accomplishment yet, becoming a mother, after what seemed like eternal labor. Now, I always knew I wanted to become a mother, and I was well on my way there. I'd not only just become a mom, though, I was also in my first year of pediatrics residency training, having started 4 months pregnant. Well, that meant I hadn't worked long enough to qualify for the Family Medical Leave of Absence FMLA. Nothing could have prepared me for the days, the weeks, and the months that followed the birth of our first daughter. I've witnessed firsthand the impact of not having paid maternal leave or parental leave. On March 8th of this year, the Maternity Care Coalition released its Paid Family Care Report, which the American Academy of Pediatrics, the AAP, supports. The AAP endorses 12 weeks of paid family leave for families. in the next few seconds or so, I'll tell you why. Paid family leave promotes recovery time for moms, thus allowing for improved physical and psychological care. In 2021, the maternal mortality rate rose nearly 40%. 40%. Importantly, more than half of pregnancy-related deaths are not only preventable, but occur within 1 year after delivery. The leading causes of these deaths? Well, mental health conditions and related deaths from suicide and overdose, excessive bleeding, and cardiac and coronary conditions. Paid family leave also promotes bonding and encourages more mothers to breastfeed, which is an evidence-proven intervention that reduces maternal and infant mortality and morbidity. Fathers are also able to be a part of the bonding process. They're important. Children in two-parent households are more likely to reach their full potential. Melinda French Gates notes in her book, The Moment of Lift, she says, when children reach their potential, they don't end up poor. Finally, paid leave promotes equity. Black women are 3 times more likely to die from pregnancy-related causes. I really hope we never get down to those numbers compared to white women. Paid family leave would also protect under-resourced families, further promoting health equity. I'd like to end with the words of the great Maya Angelou, who says, do the best you can until you know better. Then when you know better, do better. As a pediatrician, a mom, and as a resident of this great Commonwealth, I strongly believe and know that it's time to do better by all women, children, and families. Let's support and pass the Family Care Act.
Thank you, Doctor. And last but not least, kind of representing to give the business perspective, Meghan Pierce from the Forum for Executive Women. Meghan.
Good morning. My name is Meghan Pierce. I am the President and CEO of the Forum of Executive Women. The Forum is a membership organization of over 600 women who hold the senior-most positions in the corporations, nonprofit organizations, and public sector entities that drive the greater Philadelphia area economy. Our members are the leaders of the region's top companies, and we know from our own business and lived experience why this issue is so important. As women business leaders, we urge lawmakers to pass statewide paid family and medical leave legislation. As all of my colleagues here have said, the evidence for this being so effective is clear. A state paid family leave program will help stabilize the workforce and boost the capacity of the Commonwealth's businesses to not only to recruit, but also to retain the talent, which overall increases productivity and profitability. As many of my friends have said, neighboring states have this already, and we as a Commonwealth lose our competitive edge by not being able to offer this program. To remain competitive, we must do the same. Approximately 90,000 private employers in the Commonwealth offer some level of paid leave, yet 71% of all private companies employing 3.5 million Pennsylvania employees are not offering paid family and medical leave benefits to all, and that's just private companies. This is forcing workers to make that impossible choice between work and family, and women, who make up over half of the Pennsylvania workforce, are systematically forced to leave their jobs. Access to paid family leaves means we would not lose their talent. The implementation of this policy is vital to the future of Pennsylvania's economic growth. We urge the lawmakers here today to show your support of Pennsylvania businesses, the workforce, our overall competitiveness by passing this program. We also know that this will impact the future of women's leadership across the Commonwealth, which is so important. We all have the opportunity here today to make an impact on Pennsylvania's economy. Thank you.
I want to thank all of our speakers today, members of the coalition. I want to thank our champion, Senator Robinson, Senator Collett, Representative Miller, and all the other members of the House and Senate that joined us. I mean, how many more reasons do we need? We just heard them all. Something that's pro-family, it's pro-business, it'll make Pennsylvania more competitive. It's bipartisan support of it. Voters of each party across the state want it. It's time to pass the Family Care Act now. Let's get it done today. Thank you.